Good morning. I turned over Afaf Melissa's tent here because I'm not Afaf. I never could be. But I am the chair of this consensus committee. And I wanted to welcome everyone here today. The committee is sitting around the table here. We'll have an opportunity to introduce them. And I'm not going to go through any details in their distinguished careers because you all have the biographies and you can read that. So for the sake of time, I'm going to launch right in. But I do want people who may not know the individuals, if you could just raise your hand. Scott Reeves, who flew in last night from the UK. Barbara Brandt, who's sitting over there. And myself, Patricia Cuff, who makes this all happen from the staff. Janice Palaganas from Harvard and Boston, the Center for Medical Simulation. Brenda Zerler from the University of Washington. And Albert Wu from Johns Hopkins. So that's the group that is here today to engage in a very important task. And you're all part of this. And so I want you all to engage in this important task. We're here because the sponsors of this particular study, which is the Global Forum on Health Professional Education, and you'll hear from some representatives of the Global Forum shortly. But they're the sponsors of the study, and they suggested to the IOM that we needed a closer look, a deeper dive into the evidence base that interprofessional education affects outcomes, not learning outcomes per se, although that's obviously an intermediate step in virtually anything, it's learning, but in patient outcomes, in system outcomes, practice outcomes. And that's a very complicated question. If you reflect for a moment, put aside IPE as the intervention, and think of any educational intervention and what the evidence is that the distal effects, the effects that the public cares about, the effects that I know all of you care about on patient care, patient satisfaction, provider satisfaction, system changes including cost, bend in the cost curve perhaps, but at least slowing down some of the cost escalation, that any of those outcomes are easily related to educational interventions in general, whatever the intervention. It's a very complex task. So I congratulate the forum for having the courage to lay this question on the table and ask us to look at what is the evidence base for IPE. Now, why is that an important question? It's an important question because IPE has been around for a long time. In the United States, 40 years, maybe more than 40 years, and around the world for different variable periods of time as well. There's a great interest at this point in our history in looking carefully at IPE as a way in which, by improving team-based involvement, we can affect these distal outcomes. There's been a huge amount of activity in the last few years, including multiple conferences. First of all, in the forum itself. We've had at least 2 conferences directly related to interprofessional education, 2 workshops. The Macy Foundation has organized and funded several related conferences on interprofessional education and community-based involvement. The National Center for Interprofessional Practice and Education, based at the University of Minnesota, has been funded by a government grant, a HRSA grant, and with the support of several private foundations. So there's a lot of activity going on around this question. And one of the central issues, as I'm sure you've all faced in your own institutions and your own associations, is what is the evidence base that this is going to improve things? And how do we go about getting that evidence base if it's not as robust as we might like it to be? So I congratulate the forum for having the courage to put this question on the table. There are not many educators, frankly, who have had the courage to lay their particular intervention to the scrutiny that we're going to give this particular question. So with that, by way of introduction, let me, with no further ado, introduce Afaf Melis, who you all know, and now can put her tent up. And Afaf is going to take us through with several members of the forum, as sponsors, what the thinking was behind their request that this study actually be conducted. So Afaf, please.